Hello, and thank you for spending the next few minutes with us as we introduce you to one of the largest financial propositions to enter the direct selling market space, healthcare. We are very excited and bring a very focused vision as we involve grassroots people, that's people like you and people like me, to bring a solution to an enormous problem, healthcare. Our current system is filled with bureaucracy, regulatory issues that are impacting all of our access, quality, and costs. Let me ask you a question. Haven't we given big government and big insurance plenty of time to fix the problem? Let's begin to uncover the free enterprise solution. We believe it is a fundamental right of every person in every zip code to have immediate access to concierge quality health care at an affordable cost that every person and every business can pay, period. You may be asking yourself, how are we going to accomplish this? Actually, it's fairly simple. For over 12 years, Global Rescue has provided worldwide emergency medical, security, and evacuation services in 195 countries. They have been the industry leader in worldwide virtual medical care, except one country, the United States of America. That is, until now. Let me explain. Up until now, a Johns Hopkins medical doctor could provide medical care, diagnose, and prescribe a prescription for an American traveling in Egypt, but not an American across state lines. So let's begin to look further into who is Global Rescue and the solution that they are going to provide. Global Rescue was founded in 2004 by a gentleman named Dan Richards. With over 250 professionals worldwide today, having flown over 12,000 operations globally, Global Rescue has 1+ million members. Global Rescue has 8 redundant operations centers and offices in 6 countries across the world. Global Rescue has access to over 200+ medical centers of excellence worldwide. And here's the power. They have an exclusive relationship with Johns Hopkins Emergency Medicine Division of Special Operations, Elite Medical Group, and Partners Healthcare. So let's begin to explore a little bit about our team. We know that in a time of crisis or emergency, experience matters. Our medical personnel average over 15 years of clinical experience. Security personnel, they're combat experienced veterans with special operations experience. Elite Medical Group. Elite Medical Group employs physicians with an average experience level over 20 years in depth. Johns Hopkins. Johns Hopkins has been ranked number 1 in the United States 23 out of the last 26 years. In Partners Healthcare, which consists of top-ranked Massachusetts General Hospital and Brigham and Women's Hospital. These are top-ranked physicians and top-ranked facilities. Let's take a look at what others are saying about us. For example, companies of the like National Geographic, Outside Magazine, U.S. Ski Team, the Wall Street Journal, the New York Times. That is just to mention a few. I don't think it takes a rocket scientist to realize U.S. healthcare is broken and getting worse. The system wastes your time. Let's take a look at some of the numbers on time. The average PCP wait time is 19.5 days. This is according to Medical Economics 3/24/2014. The average time spent at a PCP visit is 2 hours and 1 minute. That's not our numbers. That is the HIT consultant on 10/9/2015. And the average time spent with that primary care physician is 8 minutes. So you wait 2 hours and 1 minute to visit for 8 minutes? That is a complete waste of our time. Now let's focus on how the system wastes our money. 71% of the emergency room visits are unnecessary. That's according to Truven Health Analytics on 4/25/13. ER visits are totaling today an average of $1,316. And then finally, PCP and urgent care visits average $150. That is according to debt.org. So let me ask you, are you in agreement with us that the U.S. healthcare system is broken? Change is coming. Let me ask you a question. Hasn't the I want it now mentality taken over most every activity we know? Library books to Kindle books, handwritten yearly Christmas letters to daily Facebook posts, encyclopedia libraries to Google, Rand McNally roadmaps to Google Maps, advising us of quicker routes and accident delays real time. And the one that most said would never work, Uber. You know, tap a button, get a ride? Well, make no mistake, the next revolutionary change coming is in healthcare, and it is called Global Rescue TotalCare. Let's take a look.
Global Rescue is introducing a revolutionary new way to access healthcare. It's called TotalCare, and it offers real-time access to world-class medical treatment, referrals, and information whenever and wherever you need it. TotalCare is designed to make up for the shortcomings of traditional healthcare, and it empowers you with 24/7 access to medical care from anywhere, including your own home. At the heart of the service are face-to-face video or phone urgent care consultations and specialty consultations. Both services provide access to care teams led by board-certified physicians and the clinicians at Elite Medical Group, the Johns Hopkins Department of Emergency Medicine and the Division of Special Operations, and Partners Healthcare. This unique service includes the ability to access prescriptions, labs, and diagnostic imaging for urgent medical issues. And your consultations can be reimbursable from your health savings account and flexible spending account. TotalCare members have access to two types of consultations: urgent care consultations for non-emergency, urgent medical issues that provide real-time access to medical professionals 24/7 from anywhere. The second type are specialty consultations for those stressful times when you need to confirm a serious diagnosis and the associated treatment plan. Our members always have access to some of the world's finest medical professionals when it matters most. TotalCare is designed to make it simple to access quality care from anywhere, and it couldn't be easier to use. You start by requesting a consultation, which are accessible in 3 ways: by phone, web, or mobile app. You will be connected to a paramedic or nurse who will collect information on the reason for your call, your medical history, current medications, and if available, basic vital signs. If a doctor is needed, a physician will join the virtual visit. If needed, prescriptions for non-narcotic medications, lab work, or diagnostic imaging will be ordered. Members can even be referred to more than 200 worldwide centers of excellence if an in-person visit is required. When this happens, we follow your case to its conclusion to make sure you are getting the right care. Then, you get well. If needed, we will follow up with wellness checks, and a record of the member visit can be downloaded by the member and his or her primary care physician. TotalCare urgent consults are a great option to treat a wide variety of ailments that previously could only be treated at a doctor's office, urgent care, or the emergency room. When you've received a serious diagnosis, it can be hard to know whether what you've been told is accurate. In fact, medical errors represent the 3rd leading cause of death in the U.S. That's why we work with Elite Medical Group, Johns Hopkins, and Partners Healthcare to provide access to the opinions of some of the world's best physicians. These specialty consults are performed by board-certified physicians and clinicians with specialties in the following areas: TotalCare is changing the way Americans access healthcare. It's improving access by connecting members to critical care paramedics, nurses, and physicians from anywhere 24/7. It's enhancing quality with consultations performed by board-certified physicians, clinicians, and specialists. It's reducing cost. The average primary care physician visit costs $104, and the average emergency room visit costs $1,233. For unlimited plan members, all urgent consults are included in your membership and cost nothing extra. Other memberships include the number of consults you select. If you need to buy more, you can, and they cost just $45. Specialty consults start at $150. It's increasing convenience with on-demand access to world-class medical care without the hassle of travel or wait times. TotalCare consults can be initiated anytime through our mobile app. Just tap the My Global Rescue app on your smartphone, and you will be immediately connected to medical teams who are ready to assist you. You can also use the app to access worldwide destination intelligence and to keep track of the people you care about. We leverage the latest technology to gather essential clinical information. As part of their unlimited, platinum, and gold TotalCare memberships, Global Rescue members receive a performance monitor that enables them to monitor and share vital health metrics. Members can easily share their vitals, heart rate, systolic blood pressure, blood oxygenation, and temperature. Extended TotalCare memberships are available for individuals who are 75 years of age or older. For individuals who are 85 or older, medical transport benefits are available on a fee-for-service basis. With 4 membership levels to choose from, there's one for every need. As you upgrade your membership, more consultations and other important benefits are included. The Unlimited package, our most comprehensive offering, includes an unlimited number of urgent consults each year for you and your family members, giving you complete peace of mind. Unlimited Platinum and Gold packages also feature Global Rescue's award-winning travel services, including field rescue, medical evacuation, and medical advisory services for when you're traveling more than 100 miles from home. And the Unlimited and Platinum packages even include worldwide security services. Our teams of military special operations veterans can even extract you from situations during security emergencies, such as natural disasters, terrorist attacks, and civil unrest. Our security services are available through the My Global Rescue mobile app and include access to event alerts and destination reports on 215 countries and principalities. It also includes GPS-enabled check-ins, which allow you to tell us where you are should an emergency situation arise, geofence tracking and alerts to keep track of each member of your family, and in-app messaging. And if you're far from home, Global Rescue can deploy rescue, evacuation, and transport personnel to you to bring you to the hospital of your choice in your home country at no cost to you. There you have it. TotalCare, a healthcare solution that ensures you and your family get the care you need whenever and wherever you need it.
Just ask yourself, what would your life be like if you had the ability to tap an app and tap straight into healthcare, resolving your common problem and getting on with your life? Unlike today, resolving your problem costs you time and money away from your job while it interrupts your entire day or your entire night just to get treated for a common condition that you probably already know the solution. And not to mention, but to have the supported subspecialty consults in your back pocket if or when you get that diagnosis that you're not really certain about, and just to have that extra ability to contact someone and say, this is what they're telling me, let me send you what they said, and hear from the best of the best. It goes without saying that telemedicine and its value has already been confirmed. Harvard did a study where they took 2 companies, Home Depot and Rent-A-Center. I want you to take a look here with me. Home Depot had 5,900 telemedicine consults through 1,300 employees that were chosen. On the flip side, Rent-A-Center had 3,400 telemedicine consults with 500 employees. So Home Depot had almost 3 times the number of employees as Rent-A-Center. But look at the resolution rate. Between both companies, 92% resolution rate. Look at the average savings per claim, but look at the bottom dollar. $5.9 million was a 12-month average savings for Home Depot, and Rent-A-Center experienced a $1.2 million 12-month savings. If you think that doesn't make a difference to the bottom line of a company, you're wrong. That impacts people that work for them, their ability to provide additional benefits, pay raises, and better bargains to you and I, the consumer. So make no mistake, the confirmation of the value of telemedicine has been clearly established. Let's take a look at how valuable Global Rescue's solution is as opposed to some of the other virtual healthcare providers on the market. We'll spend the next minute or so taking a look at this chart because if you really look at it, one place I want you to really focus on is going to be toward the bottom where it says embedded in insurance. None of them are embedded in insurance except for one called Teladoc. But ask yourself, if the insurance company has it embedded in their insurance policy, are they really trying to offer you a service or are they really trying to reduce their cost? I don't think it takes a rocket scientist to uncover that answer. Take a look at imaging in labs. Global Rescue is the only one that can request imaging and request labs. All of them offer prescriptions, subspecialty consult. Global Rescue offers 18 subspecialties, whereas Doctor on Demand, Teladoc, and MD Live are very, very limited. And then again, 24/7, 365 emergent care ops hotline globally, not just domestically on 3 of our membership options. So how are we going to compete? How are we going to do this? We're going to use cutting edge technology. We have a mobile app. The person that you're sitting with can display that to you. You have emergency communication. We have intel reports for over 200 countries. We have GPS location tracking and real-time medical consultations. The person that you're visiting with has got a body metrics device. This is the device that we are able to track and record the vital signs, like when you walk into the doctor's office and they get your temperature, your blood pressure, your pulse, and things of that sort. Same thing. Here's another benefit. You can even download the results to your electronic health record. That's how we're going to do this, using cutting edge technology and get out of the dark ages. Let's take a look at a video of a real live occurrence.
Hi, I'm Linda Hanks. I'm from Forney, Texas. I have 2 beautiful children, Andrew and Emily. I used TotalCare because I was coming down with a sinus infection and we were about to leave for a Vegas trip. And I didn't have time to go anywhere else, and it's just convenient. As I'm packing, I can use the app. So immediately was contacted by an EMT and got my flight information so that they could help me when I landed. We landed in Vegas, and within 10 minutes I was receiving a phone call from Garrett, the EMT at Global Rescue. He patches me through, and I am seeing the doctor face to face, just like we were sitting in a room. She was assessing me, asking me questions, going over my medical history a little bit. She was able to assess me just by looking through the camera on my phone. And then she has me pressing on my face at the sinus points and looking left, right, up, and down as I'm in the car with my husband driving to our hotel in Vegas. She said she doesn't normally give out antibiotics for a sinus infection, but with my medical history, she was going to recommend it. We stopped at the hotel, unloaded our bags, jumped back in the car, drove to the pharmacy. My prescription was there, picked it up, drove back, took the pill, went to dinner with my friends, all within an hour from start to finish. It was so convenient. I can't describe in words how important it was not to interrupt our trip. And I know that any trip I go on, I'm covered. I would tell my friends to sign up for Global Rescue and TotalCare just for the convenience and the peace of mind. Global Rescue will help them get what they need at the time to either get them fixed on the spot or until they can get somewhere.
So now that we have a better understanding of the solution that Global Rescue and Global Rescue Direct's service named TotalCare brings to the table, let's start evaluating the average family of 4. Let's begin rethinking our own health care. This is what is totally profound. Here is a very disturbing law of probability. Let's take American Roulette, for example. On a single number bet, 2, 5, 8, it doesn't matter. Do you understand we have a 2.63% chance of winning that game of American Roulette? Let's take a look at what Freedom Life Insurance Company in their own publication posted. 97.6% of their insured's annual claims were under $5,000. That means only 2.4% of the time Would you ever exceed $5,000 of expenses annually? Look at the numbers, their own numbers. 2.1% of their claims were 5,000 to 50,000, and 0.3, that's less than 1%, were 50,000 or greater. So 97.6% of those claims are under $5,000. So doesn't it make you want to ask, why are we spending between premiums and deductibles 5,000 or greater? Why? Well, it kind of makes sense, doesn't it? Because remember, the house in Vegas always wins. And the house in this case is the insurance company. Aren't we self-insuring ourselves when we don't spend what we pay in premiums plus deductibles? So now let's switch gears and begin to look at the Affordable Care Act, or commonly known as Obamacare. Obamacare uses various metals to break apart the various plans. This chart and numbers are reflective of data from January 4th, 2016, found at healthpocket.com. You can see the links and access them yourself. These plans reflect individual plans, not family plans. And remember, we're evaluating a family of 4. So to try to get as realistic as we can, we're going to use the most expensive in these displayed numbers in order to reflect a family, because we all know a family plan is greater than an individual plan. So let's take a $1,000 medical expense example. Obviously, the higher our monthly premium, the less we pay as a copay when we visit the doctor. So just like the insurance company said, 97.6% of the time, their claims were less than $5,000. So the person on the platinum plan that is making a monthly payment of $1,154.51 is spending close to $13,000 a year to not need $5,000 a year. Isn't that interesting? So let's take a look at this. If you had the monthly high premium of $1,154 on the platinum plan, 90/10, that means you're going to pay 10%. If you're on the gold, you're going to pay 20%, and so forth. You get the point. Can we not agree that monthly high premium in anticipation of a service we're 97.6% of the time most likely not going to use is rather ludicrous? Let's take a look at the breakdown. These are the Centers for Disease Control statistics. The annual primary care physician or urgent care visit per year for a family of 4 is 12. The annual number of emergency room visits average 2 for a family of 4. The annual cost of the Affordable Care Act Gold plan is $10,911. The annual cost for the Silver plan is $8,940. So let's just imagine a family of 4 transitioning from Obamacare Gold to Obamacare Silver and saving $1,971 a year. And remember, we're anticipating something that's not happening. Those are the insurance company's own words. What if we add to that? If we are able to save the family of 4 from going to the emergency room at 2 in the morning because of a high fever or a common condition, and we switch to TotalCare, we're going to save that family those 2 visits at $1,316 apiece, generating a $2,632 savings. And what about saving them 8 of the anticipated 12 annual urgent care visits and switch those to tap the app and get TotalCare? That generates an additional $1,200 a year in savings. So the total savings that year is $5,803. Let's look at the expense that we've got to spend in order to save that $5,803 a year. Having a family of 4 join the TotalCare solution at the Silver Family Membership level is an out-of-pocket expense of $390 a year, and that will cover a family of 8. And let's include 6 additional consultations at $45 a piece, because 2 come free with their TotalCare membership. That's going to generate an additional $270 out of pocket for a grand total expenses of $660. Look at the net savings by just rethinking the average family of 4 expenses yearly. That is going to generate an estimated net savings of $5,143 annually, which is over $400 a month in savings. Do you understand that is a car payment, or perhaps that's grocery money, or even clothes money? And we're not even talking yet about the person that sees TotalCare and Global Rescue Direct as a financial solution for them. Let's take a look at the TotalCare plan options. We have 4 different options in the TotalCare solution. We basically need to determine, are you a family or are you individual? We have an unlimited plan, a platinum plan, a gold plan, and a silver plan. For 2 of the plans, we give you a monthly payment option. Working with your global business owner, you all can determine the plan that is appropriate for you. Oh, and by the way, be sure and inquire with your global business owner about getting your referral fees for recommending TotalCare and the Global Rescue Direct service. They can guide you best, but it's only a separation factor of $50 to $55 max. And regarding our global business owner opportunity, we're looking for people to join our team. As we said in the very beginning, this is a grassroots movement. This is people like you and people like me taking this TotalCare solution to the world. We have a revolutionary track record of 12 years. It's a $4 trillion market. We have 3 levels of compensation bonuses. Those are team builder, unilevel, and global pool bonuses. And let me ask you, when is the last time your insurance company ever paid you a check to refer them, recommend them, or take care of your own health care? You can set your own schedule and work with those you want to work with. And most importantly, we can do well financially by doing good in the world. What does becoming a global business owner enrollment kit look like? Your global business owner is sitting right there with you to show you the electronic version of the videos so that when you sit down with your family and friends, you're well prepared and you don't even have to do the talking. It's also going to come with a Bluetooth triage device for the unlimited, platinum, and gold memberships. A silver plan owner can purchase that Bluetooth triage device separately. As a global business owner, we mentioned the compensation bonuses. Number 1, the team builder bonus, the unilevel royalty bonus, that's called residual income, and the global bonus pool. That's when the money gets big because you're tapping into what's going on globally, not just in your organization. Your global business owner's goal is very simple: to drastically reduce your family healthcare costs, eliminate the wasting of your time and money just to get solutions to common everyday health issues, and provide access to a concierge quality healthcare and follow-up experience at a cost you can afford. So, is this you? Are you ready to begin rethinking your individual or family healthcare experiences and expenses? Your global business owner is prepared and ready to help you get started today. At Global Rescue Direct, we are very aware that people are living quiet lives of desperation, and we are looking for heroes to help deliver this revolutionary transformational solution to the world and get paid for making the link. Are you, or do you know someone looking to be part of a revolution that is going to be so grand that it flips U.S. healthcare on its head by building an army of entrepreneurs that are like stealth bombers in the night as we work feverishly to solve the healthcare access, quality, and cost issues of every American? We will do it. How will we do it? One life at a time, one day at a time. Your first step is make a decision to save money through the use of TotalCare. Then, make a decision to make money by sharing TotalCare with others. After all, remember, the difference between using TotalCare and sharing TotalCare is less than a $60 investment. In closing, at Global Rescue Direct, we make a difference before we make a dollar. Inform your global business owner of your decision. They are part of a revolutionary company and a very heartfelt team. Once again, our vision is very straightforward. We believe it is a fundamental right of every person in every zip code to have immediate access to concierge quality healthcare at an affordable cost that every person and every business can pay. Period. We look so forward to your decision, and we hope we've added value to your life. Thank you for your time.